There are a lot of different things that we do in our practice in order to minimize pain from the surgery and also to minimize the chances of developing chronic pain later on, a year later after the surgery. One of those things that we do is a long-acting nerve block at the end of the procedure. Now this is done with one of two different medicines, either a medicine called Zynrelef or another medicine called Exparel. The idea behind this is that it mimics in some ways the effects of the nerve block that you had before surgery, the one that we used to figure out whether or not you were a candidate for surgery. But instead of lasting a few hours, this nerve block will last anywhere from 2 to 7 days, depending on your metabolism and depending on which nerves we're working on. So what does that do? It's intended to significantly decrease the amount of pain that you would have right after surgery because your brain doesn't know in some ways that you're having as much pain as you would otherwise. It's the same effect as from the injection that you had before the surgery when we did the diagnostic injection. And so the idea is that this will help manage your pain when the pain would otherwise be the worst, okay? Does it mean that you're gonna have no pain after surgery? No, you'll have some discomfort, some soreness, but the block helps with that pretty significantly. Now, depending on your metabolism, as I mentioned, it may take a couple of days before it starts to wear off, or it may last as much as a week. Now, that doesn't mean that the block is going to wear off all of a sudden. What most patients tell us is that they start to notice after a couple of days that it's becoming less and less effective, or the way they usually describe it is that they're getting more and more sore after the surgery. And that's very typical. It should be expected. Somewhere between 1 and 2 days after the surgery, you should start to notice more soreness than you did when you woke up from the surgery. And that'll get progressively more pronounced over about a week after the surgery. That's normal. That's to be expected. It's part of the healing process. And believe it or not, the pain that you have 1 week after surgery, even though it feels like it's more intense than it was right after the surgery, is significantly less than it would have been the day after surgery if we hadn't done the nerve block. So something to keep in mind. The nerve block will wear off, and it'll wear off over the course of about a week, depending on your metabolism. Some patients it'll last longer, other patients it'll last less time. But don't be surprised by that. Don't be discouraged. This is part of the healing process, and we made this video to help you to understand what to expect.